NCLEX RN practice questions on oncology. Question 1. Set 1. What is the significance of the TNM staging system? To determine the cause of cancer, to classify the extent and spread of the tumor, to measure the effectiveness of chemotherapy, to identify genetic markers. TNM stands for tumor size, node involvement, and metastasis. Question 2. Set 2. Which electrolyte imbalance is associated with Trousseau sign? Hyperkalemia, hypocalcemia, hyponatremia, hypermagnesemia. Trousseau's and Klosteck's signs indicate hypocalcemia. Question 3. Set 3. Which sign indicates a potential complication of a thyroidectomy? Sore throat, laryngeal stridor, fatigue, dry skin. Stridor indicates airway obstruction, possibly from edema or nerve damage post-thyroidectomy. Question 4. Set 4. A patient is post-bronchoscopy. What is the nurse's priority assessment? Pain level, gag reflex, urinary output, blood pressure. The gag reflex must return before the patient can safely eat or drink to prevent aspiration. Question 5. Set 5. Which is a common side effect of radiation therapy to the head and neck? Diarrhea, xerostomia, hematuria, clubbing of fingers. Xerostomia, dry mouth, is common when salivary glands are in the radiation field. Question 6. Set 6. What are the 3 P's of diabetes mellitus? Pain, pallor, pulselessness, polyuria, polydipsia, polyphagia, poverty, pollution, population, pressure, paresthesia, paralysis. Excessive urination, thirst, and hunger are classic signs of hyperglycemia. Question 7. Set 7. Standard precautions apply to which of the following? Only patients with known infections, all patients regardless of diagnosis, only patients in ICU, only surgical patients. Standard precautions are used for all patients to prevent cross-contamination. Question 8. Set 8. Which EKG change is most indicative of a myocardial infarction? PR interval of 0.16 seconds, ST segment elevation, T wave inversion, presence of AU wave. ST segment elevation indicates acute myocardial injury. Question 9. Set 9. What is the therapeutic level for lithium? 0.1 to 0.5 milliequivalent/L, 0.6 to 1.2 milliequivalent/L, 1.5 to 2.5 milliequivalent/L, 3.0 to 4.0 milliequivalent/L. The maintenance therapeutic range for lithium is 0.6 to 1.2 milliequivalent/L. Question 10. Set 10. What is the primary goal of care for a patient with Alzheimer's disease? Curing the disease, maintaining safety and function, improving memory, teaching new skills. Management focuses on safety, nutrition, and maintaining the highest level of function possible. Question 11. Set 11. Which breath sound is commonly heard in a patient with an acute asthma attack? Crackles, wheezing, rhonchi, pleural friction rub. Wheezing is caused by air passing through narrowed airways. Question 12. Set 12. What is the golden hour in newborn care? The first hour after birth for skin-to-skin and bonding, the first hour of active labor, the first hour of the second stage, the hour before discharge. The first hour after birth is critical for bonding and initiating breastfeeding. Question 13. Set 13. A client is diagnosed with peripheral arterial disease, PAD. Which symptom should the nurse expect? Dependent rubor, painless ulcers, bilateral edema, warm skin. Dependent rubor, redness when legs are down, is a common sign of PAD. Question 14. Set 14. A patient with type 1 diabetes is shaky and sweaty. What should the nurse do first? Administer insulin, check the blood glucose level, give 15 g of simple carbohydrates, notify the provider. Assessment of blood glucose is the first step when hypoglycemia is suspected. Question 15. Set 15. Which sign is a hallmark of pyloric stenosis in infants? Green diarrhea, projectile vomiting, steatorrhea, abdominal distension. Projectile vomiting after feeding is the classic sign of pyloric stenosis. Question 16. Set 16. A patient is hearing voices that say, "Kill yourself." What should the nurse ask first? How long have you heard these voices? Do you have a plan to carry this out? Why do you think the voices say that? Would you like some medication? Assessing for safety and a specific suicide plan is the priority when a patient reports command hallucinations. Question 17. Set 17. A mother is Rh negative and her baby is Rh positive. When should she receive RhoGAM? At 28 weeks and within 72 hours of delivery. Only at delivery. Only if she has a second child. At every prenatal visit. RhoGAM is given to prevent isoimmunization in Rh negative mothers. Question 18. Set 18. What is a common side effect of ACE inhibitors? Constipation, dry, non-productive cough, weight gain, hyperactivity. A dry cough is a common side effect of ACE inhibitors due to bradykinin accumulation. Question 19. Set 19. Which type of immunity is gained after receiving a vaccine? Natural active, artificial active, natural passive, artificial passive. Artificial active immunity results from vaccination. Question 20. Set 20. A patient on chemotherapy has a platelet count of 20,000. What is the nurse's priority? Infection control, bleeding precautions, managing nausea, increasing protein intake. Thrombocytopenia, low platelets, puts the patient at high risk for bleeding.